Hey guys, Dr. Ben Sweeney here. So I wanted to personally welcome you to the knee pain seminar and workshop. So in the video that's following, we're going to talk about knee pain, the solutions, the hope, and really just some of the treatment protocols that allow us to live pain-free in our knees, to not have to live on drugs, not have to have surgeries. And knee pain is a very intimate problem with me. I had a torn meniscus back in September of 2022, and I opted to not do surgery. I went with stem cells and PRP and the treatments that we use in our office. And I went from having swelling and couldn't kneel on it and certainly couldn't run or play basketball to now I'm living pain-free and, play basketball once or twice a week. So essentially have a brand new knee. So we're going to talk about some of the treatment protocol that I used and some of what we use with patients in the office, because we don't have to live in pain. We really don't have to suffer, but you got to put the right game plan in action. So stay tuned. The video's coming up next, and I can't wait to see you on the other side. Hey guys, I'm Dr. Ben Sweeney, and I want to personally welcome you to the knee pain workshop in our office. So I'm the founder and CEO of Sweeney Health Centers, and today we're going to talk about knee pain. So this workshop is primarily for people that want to feel between 60 and 100% better. And that number is from the data and the stats and the previous experience of working with people in our office, that when they qualify for care with their knee pain, they experience anywhere from 60 to 100% results. So it's a little bit of a range, but for the most of the cases we accept, they more or less, by and large, will get better. So today's about how you can get relief. And there's a lot of misinformation in society and current culture about knee pain and what it takes to get better and if it's even possible to get better. And that's the hope that we're going to give you today, that for most cases it is possible to get well. So if you're having knee pain, joint pain, a lot of the same principles we're going to talk about apply to joint pain as well as knee pain. So shoulders, hips, elbows, ankles. Similar conditions can occur in multiple different joints. So after today, the goal is to make sure that you understand the truth about the current standard treatment of care when it comes to knee pain, the proven methods that we use in our office to provide lasting relief and actually to get to the root cause of why the knee pain is there in the first place, and then some simple steps that you can take today to get on the road to feeling better, moving better, having better function, and really just being able to live the active, full life that you deserve. So that's the goal. So let's talk about a thing called arthritis. I think a very commonly overused, misused, abused term that we use in society. When I hear it at my office, it kind of makes me cringe, because for most people, when they use that term arthritis, or they've been told that they have arthritis, in essence, it's a death sentence, that it's only going to get worse. There's nothing that can be done, and just be prepared for a life of more pain, more disability, less function. And quite frankly, that just is not the case in the vast majority of situations. So the definition of arthritis is inflammation of a joint. So when you see arthritis, arthro is the first stem root word of that. It's a Latin word for joint. And then itis is the Latin word for inflammation. So it really just means joint inflammation. Doesn't tell you the extent of the damage. It doesn't tell you how it got there. And it doesn't tell you how far along the problem is. It just tells you that one of your joints is inflamed. Now, when it comes to the symptoms, the main primarily are joint pain and joint stiffness. Immobility, loss of range of motion, those are the more common ones. And then the most common type of arthritis is what's called osteoarthritis, which is the one, when people have knee pain, that's usually the one that they're referring to when they say the term arthritis. And it's a deterioration of the cartilage that's found between the joints. So it's kind of like the loss of that coating, that covering, that protective meniscus layer, and that cartilage layer starting to deteriorate. So most people that we talk to have been told that, you just have bone on bone, it's bone on bone, and that's the pain, and there is no hope. So let's talk a little deeper about what bone on bone actually means. In America, about 50% of Americans 65 and over have had doctor-diagnosed arthritis. So it's over half of us. And I think if more people went to their doctor, the percentage of people being diagnosed would actually be much higher. But as now, it stands at about 49, 50%. Most people we speak to are sick and tired of taking medications. They know inherently that most of those drugs are just covering up their symptoms. And people, over 40% of older adults take 5 or more prescriptions per year. Now, In my case, I'm 45, so it's about, the average 45-year-old in this country takes 4 drugs. So I don't take any, so that means someone's taking 8 drugs to make up for my 0 to average out at 4 per person. 20% take 10 drugs or more. And that number's just climbing every single year. We take more and more drugs. We guzzle down more pills, and yet the problems seem to just keep getting worse. So the disturbing trend in pain management are opioids, and they get a lot of press nowadays. I'm so glad it's becoming more prevalent that people are talking about opioid abuse and problems with addiction with opioids and coming off of those pain medications. It's really becoming the #1 killer in our youth. So it's not only the older people that struggle with them, but it's our younger people that are getting a hold of them. It's really destroying lives. And that's hit very close to home with me. Just lots of personal experience within my family with opioid abuse, and the results are just devastating. And when it doesn't fix the problem, when it destroys lives but doesn't ever fix the problem, I think we got a big problem there. So let's talk through this. So knee pain, knee arthritis, and cartilage degeneration. So if you look at the knee, the normal joint or the normal knee joint has a nice space on the outside, nice space on the inside, and then even cartilage, no tearing, no wearing, no degeneration. And then when you get to what's called osteoarthritis, we start to primarily lose that medial, the inside part of the joint space first. So that's where you start moving toward that bone-on-bone phenomenon. And then with the grading system with this, we have a grade 1, grade 2, grade 3, grade 4. So people that have been told that they have arthritis in their knee, they're rarely told what grade of arthritis that they actually fall in, because clearly the further down the road you get, the harder the problem gets to fix. So if we're in these earlier phases in the simpler grades, it's obviously much easier to fix that underlying problem. So a normal knee, we said again, joint spacing clean on the inside and outside. We have normal range of motion, normal mobility, no swelling, no pain going up and down stairs, getting off the toilet. Like your knee is able to work and function not only the way it looks on an x-ray, but it actually functions like a normal knee, because the knee joint should not be painful. In fact, the knee joint is essentially like a hinge joint. There's some rotation, there's a little bit of lateral flexion, but by and large, your knee functions like a hinge in the door or in your car. So those joints actually should not bear much of the load. Most of the load bearing should actually be done by the muscles that surround the joint. So the quadriceps muscle, the hamstrings, even the calves. The musculature around the knee is really so crucially important, which is part of our treatment regimen. And we want to get those muscles back online. We have to get them reactivated, and we also have to get them stronger again. So your current choices for help when you have knee pain, it's not a pretty picture. We have what are called NSAIDs. Those are non-steroidal anti-inflammatory drugs like ibuprofen and acetaminophen and aspirin, Tylenol, Advil. You've heard all the brand names. And again, do they have benefit in the short term to relieve pain, help you get a better night's sleep, get through the long golf round? Sure. But does it fix the underlying problem? And the answer is clearly no. So some of the side effects, and this is a short list, we have stomach ulcers and stomach bleeding. We have high blood pressure, fluid retention, and kidney problems, and then also heart or cardiovascular problems that come along with this as well. We know that about 14,000 Americans die every single year from normal acetaminophen, normal Tylenol use. So they take their Tylenol just the way they were supposed to by doctor's orders. They weren't taking an excessive amount, and about 14,000 people every year die in this country from normal use of that drug. That's the little known secret that we don't hear about, because it's in everybody's medicine cabinet, it's in everybody's purse or pocketbook. We carry these things around like they're little benign white saviors used in case of emergency, but they actually come with very, very severe risks in a lot of cases. Cortisone injections, that would be another option. That's where they actually inject a powerful steroid into the knee called cortisone, which is a powerful anti-inflammatory. And quite frankly, it works. It actually does. It actually works to reduce the inflammatory process, but it doesn't fix why the inflammation was there in the first place. So in essence, although you can get relief from these, it's like taking the batteries out of your smoke detector, because the pain in the knee, the pain is not the problem. The pain is the symptom that there is a problem. So if we're just treating the symptoms, we're putting duct tape over the oil light, we're taking batteries out of the smoke detector, we're turning off the body's inborn system that's designed to tell us when something is malfunctioning. We would never do that with our car, but with our bodies, we do it day in, day out. So some of the side effects of cortisone, some thinning of the bone or some osteoporosis, which is a common side effect of any kind of corticosteroid, easy bruising, weight gain. We see a lot of people that have been on steroids, prednisone, for a long period of time, and their face gets really puffy. They gain 15, 20 pounds, literally seemingly overnight. One of the common causes of high blood pressure is actually that corticosteroid or cortisone use. Side effects: cataract formation, thinning of the skin. I mean, this is not an exhaustive list, but it's some of the high points. But no drug comes without side effects. You have to pay the piper. If you change the body chemically one way, or you suppress a reaction or a chemical process in one direction, you're going to pay the price in another direction. Everything comes with side effects. Cortisone actually eats the joint. We use the analogy that it's kind of like battery acid in the joint. So it destroys that hyaline cartilage and ages the knee prematurely. That's why they don't want to do cortisone too many shots too often, because they know that it has a destructive effect on the joint itself. Or if the cortisone doesn't work, they refer you to an orthopedic surgeon, which the main treatment program there is, knee replacements or scoping the knee to clean that out. And again, that has value. I have a lot of people, you probably know someone yourself that's had, a knee replacement, or they've had their knee scoped, and they do obviously feel better, but that's not the only option, the drugs and the surgeries. So you've been told you're just going to have to live with the problem. It's just going to get worse. You're going to have to modify your activity, stop playing tennis, quit playing golf, just get used to the pain. There's not much we can do, or you're a candidate for surgery. Insanity is doing the same thing over and over, expecting different results, and almost comically, we continue to do the same thing in our healthcare system over and over, expecting it to actually fix the problem. The problem with our healthcare system is there's no money in healthy people and there's no money in dead people. The only money in our healthcare system is in sick people who have disability and problems and lack of function. They're in pain, they're suffering, and quite frankly, sometimes they see themselves as a victim, and then they look to the experts to fix their problem. So the only money in the system is in really sick people with problems. And as long as the current system pays doctors to treat sick people versus reimbursing them, incentivizing them to keep people well, I don't really see an end to this current healthcare crisis. We need more people less sick. I think that's the solution. So what's the secret? So in our office, we use a myriad of different treatment protocols and different technologies in our office. One of the things that we use in our office is a thing called a knee on track. So it's essentially a decompression machine for the knee that you sit in the chair, it straps you right below the knee and then in the thigh, and it pulls the knee apart up to 5 centimeters apart, and it creates a suction effect where it pulls fluid, nutrients, blood, oxygen back into the joint to complement some of the other therapies that we use to actually allow the joint to heal itself. So it's essentially like a decompression for the knee joint. So we also use a rebuilder, which are these little straps that go above and below the knee that actually will stimulate the muscles. Like we said, the quads and the hamstrings and the calves are some of the main primary support system for the knee, and we have to get those back online, and we do that with this electrotherapy. Painless, but very effective. Then we also use a UV red light therapy on the knee, which is designed to stimulate blood flow to the area. And it actually creates a process of what we call angiogenesis, where it creates new blood vessel formation. So that's one of the main benefits, and we use these in conjunction with each other. We also use a class 4 medical grade laser therapy. So it's essentially a laser therapy that is designed to reduce inflammation. It's analgesic, so it helps to reduce pain, accelerates tissue repair and cell growth, improve vascular activity, and it also improves nerve function. So most people after their laser therapy, they can almost feel an immediate benefit, reduction in pain, and it's completely painless during the process. So the question is, how does this work? So the laser works by penetrating deep through the skin, the fat, the muscle, into the joint itself, and it actually stimulates an enzyme within the mitochondria, the little powerhouse of the cell, to produce more ATP or more energy. So you're getting an accelerated healing response by applying that laser. And it shows we can increase angiogenesis, like we said, new blood vessel formation, increase collagen, muscle regeneration. It can reduce muscle atrophy, and you can also get a reduction in inflammation and edema, regenerate nerves, regenerate cartilage, and increase the formation of bone. So it has a multi-factorial method of improvement, which is not just about pain. It's actually allowing the body to heal itself instead of just treating the symptoms. So 377 different peer-reviewed research articles on laser therapy. I won't bore you with going through all those, but the literature is very clear and very robust on the effects of laser treatment on the knee. PRP, another option we have in the office is a technology called PRP, or platelet-rich plasma, where they essentially take blood, they spin down the platelets, and they inject them into the knee. And we use a product that's already preformed, so we don't have to draw your blood, and the plasma is much more rich with nutrients and growth factors, and it's just a much more powerful healing response, and it's much more comfortable. So that's used to treat shoulder injuries, elbow problems, back, neck, hip, knee, wrist, hand. You can almost use it in every joint of the body, and we can also use it in the soft tissue as well if we need to accelerate the healing response. And in most cases, it provides an almost immediate reduction in pain and swelling and the sensation of like that stiffness and soreness. We also use tissue nanoparticles, which are basically stem cells, from a company called VD Labs. So it's a GMP certified. They go through all the testing in the screening of the mothers. They basically take, and when we talk about stem cells, I'm extremely pro-life. I'm on that side of that argument. For sure. So they'll take the fresh cells from scheduled C-sections. The mothers that are screened, they take the scheduled C-section, and from the placenta and the cord, what they would normally just discard, they actually harvest fresh, brand new, healthy, undifferentiated mesenchymal stem cells. And those can be processed and then inserted into the joint to actually rebuild the cartilage, remodel the bone, and actually heal the underlying condition. They go through tissue banks that focuses on is AATB accredited, CGMP certified, FDA registered. It's used for the Los Angeles Rams, the Oakland Raiders, the UFC. It qualifies under all the anti-doping regulations, so it's being used by the professional athletes everywhere to the housewife. So imagine for a moment that you can be able to get up and down stairs easier, that you can get out of the car without pain, you can play tennis, you can walk steady without losing your balance, take trips, hike, play golf, whatever your zest for life calls for. We can do that if we have less knee pain. So most people say, they come into me and they say, you know, I ask them why they're here. Like, what can I help you with? Why are you here? And they'll say, well, you know, I have knee pain. And I'll say, well, why do you want the pain to go away? And they'll say, well, you know, because it hurts, and, you know, I'm tired of dealing with soreness and pain in my knee. And I say, well, why is that important? Well, I say, well, because when my knee hurts, I can't sleep very good. And then I say, well, why is that important? Well, because when I don't sleep good, I don't have energy, and I can't do the things I want to do. So really, the reason people want to get well is not to get rid of the pain. It's what the pain is keeping them from doing and enjoying in life. So that's really the underlying principle here, is we want to get well so that we can live a full life. And that's what we're helping to do. So from here, if you're interested in getting checked out, get an exam, or kind of see what we do, the technologies we use in our office, what we do now is you reserve your spot. So you click on the link below, or you can call our office or reach out through this webinar to get a consultation, x-rays, exam, to even see if you're a candidate for the type of care that we provide in the office, because we do not accept everyone for care. Some people, unfortunately, are just too far gone, and we have to be honest when we have that conversation that, you know, it's just not worth the time and the energy to try to help that particular type of person. So we ask you, when you come to the office, bring the person that's closest to you. It's a spouse or a good friend or a child or someone that's in your family, because we want to ask them questions that you may not know about yourself. So how do they get up the stairs? How often do they complain about this problem? It's just always good to have another set of eyes and ears and get a real clear picture of actually what's going on with your health and how it's affecting your life. So the initial visit is a consultation, exam, and then also x-rays. So we do a very thorough exam. We take x-rays of the knee, and if we need advanced imaging like an MRI, then we can refer you out to get that, as soon as that same week or the next week. So it just depends on the case. If you have imaging that you've already had done to your knee, or you have medical records, please bring those with us. That's crucial. It makes our job much easier if we already have all the information on the front end. And the one thing I would ask too is bring your list of medications, because we want to make sure that everything we do doesn't interfere at all with your current medical treatment and that there's no contraindications to what you're currently doing. So let us know a real clear picture of what's happening with you by giving us all the information about you that we can. So the normal pricing for this is $249 for the exam and the x-rays and consultation. But if you're watching this video, you're watching this webinar, that consultation, exam, and x-rays is only $59. That's if you sign up because you saw this webinar. So that's not the going rate out in the public, but for you guys, we're going to make that happen. So who should not come in for a consult? If you are not serious about getting better, if you're just what we call a tire kicker, you really got no intention to change anything in your life, because I will tell you straight up, this is honest on the front end, that we will be asking you to likely eat better. We at least want to look at your diet and see what you're eating. We want to see what your movement patterns and your sleep habits are. We want to know a clear picture about you, and we're probably going to recommend things beyond just treating your knee in order for you to get healthy, because most people need to lose weight, they need to reduce inflammation, they need to change their diet. So our goal is to help them succeed in all of those areas and get the knee better at the same time. So again, my name is Dr. Ben Sweeney. Please click on the link below or text, ask any questions that you have about your knee, and hope to see you soon. I look forward to meeting you in person, and have a wonderful day, and God bless.